All right, good morning, everyone. It's 9 a.m. Today's October 22nd, 2025, and we would like to ask Pastor Bill Anderson, if you would, to lead us in the invocation and Pledge of Allegiance. Thank you.
That you would protect all the teachers, the first responders, the police officers, fire, everybody that has their hand in contributing to the welfare of this county, Lord. We ask that you would protect us. We ask that you would form a hedge of protection around us with all the things that are going on, especially in the world today, Lord. And we ask that we would just clearly see your path, Lord. We ask that in Jesus' name. Amen. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. We'll call this meeting to order and ask for roll call, please.
Commissioner Buck? Here. Commissioner Schroeder?
Here.
Commissioner McDaniel?
Here. All right. First item on the agenda is the approval of the agenda. Is there a motion to approve?
Yes, Commissioner, I'll make a motion that we approve the agenda as presented.
There's a motion and a second. All in favor, sign of aye.
Aye.
Aye. Motion carries. At this point in time, I'd like to get a motion to open the Board of Health portion of this meeting.
Mr. Chair, I move that we open as the Board of Health.
Second.
There's a motion and a second. All in favor, sign of aye.
Aye.
Aye. All right. Motion carries.
Thank you. Good morning. Give me just a second while I edit my slides here and then I will get you guys up and running. Okay, perfect. So good morning. I am Sarah McIntosh. I am the Public Health Director here in Elbert County, and this is our Board of Health update for the third quarter of 2025. Today I'm going to cover current staffing, programs that we have running, clinic services, environmental health, vital records, and health promotions that we are working on, as well as addressing some ongoing concerns and then follow up with some questions and answers. Currently, I have 3 full-time staff. I did have to eliminate a position due to some of the budget cuts in public health from grants funding purposes. And I have 2 nurse practitioners on staff that are part-time with me. One is a pediatric nurse practitioner who's in office on Mondays, and my other family nurse practitioner is actually going to be leaving us, and she needed something full-time. So she is going to be giving us a day or 2 a month to come in and cover until we get somebody new on board. So that position is posted right now. So if there's any nurse practitioners that are looking for a part-time job, please feel free to apply. Contracted staff we have on board is Dr. Couch is our medical director. Teresa Klaus is contracted with us from Health and Human Services, helps manage our finances and grants. And then we contract with Douglas County to manage our tobacco education. So John Michael McCaskill is new with Douglas County. Their previous tobacco educator moved on to a different role, so he stepped into that position. And just this month, we contracted with a medical biller or coder who will take a small percentage of the clinic revenue to help increase that. So hopefully in the next Board of Health meeting, I will have increased revenue generated there. My per diem staff, I have kept on our previous environmental health staff to help give Marissa a break from time to time. If she needs a vacation, they will help cover and do inspections so we don't fall behind on those and people aren't waiting on us. So here is our clinic revenue for this quarter. So we had a very successful quarter this quarter. We did a health fair day where we had about 35 people show up for sports physicals and adult well exams, as well as did an on-site sports physical at one of the local schools. So we had a big jump in our numbers there, a total of 330 appointments for the quarter. About 151 of them were pediatric, which is pretty typical for the pediatric population as we start seeing them before they go back to school. Adults is right on target at 179, and immunizations is up a little bit. Again, that goes along with the school time frame that we see more of those. And we've also seen an increase this month in our TB test visits because it's the beginning of the school year, and the student nurses that are getting ready to enter the CNA program at Elizabeth High School all need TB tests, so they have been coming out to us to get those. And this kind of just shows you a breakdown of where our clinic visits have been and where they're continuing to grow over the last 3 years since we opened the clinic. An update for folks that are looking for them, seasonal flu vaccines are in. So we work with most major insurance companies, including Medicare and Medicaid, and we do have some vaccine we can do at low cost for people that don't have any insurance as well. Please feel free to give us a call and schedule an appointment if you're interested. This is our, onto environmental health. This is our food license revenue. And typically, as you can see the past several years, it's always heavy Q1 because all the existing food establishments renew at the beginning of the year. Sometimes we see a little bit more of a bump in Q2 because that's people that are just doing the food trucks that might be seasonal, that don't necessarily license right away at the beginning of the year, and it tends to filter off as the year goes on. So we are right on track to where we were last year as far as food license revenue. So moving on to our on-site water treatment systems. And we have, this is our numbers of permits we've had pulled this year for new systems, new septic systems, repairs to existing septic systems, and then use permits there. So we're at about 519, which is on track for where we were about this time last year, with the exception that you never know for sure where things go, and we do tend to slow down a little bit at the end of the year. So we'll see where numbers fall out at the end of this year. And this shows how many inspections that we've done every month. So we are almost at where we were at the end of 2024 as far as inspecting systems. And this doesn't always adequately reflect how many permits are pulled because some systems are inspected multiple times. If there's issues, it might take multiple trips out. And this is where our OWTS revenue is for the year. So we are on track to supersede where we were last year, but that's just because the number of permits we're pulling over the summer have been higher. So new changes coming in environmental health, specifically OWTS. The state has implemented new regulation changes. The state adopted theirs in June of last year and are giving us until June of 2026 to adopt new regulations within the county. There are some that the state has mandated and some that we will get to choose. So what I would like to do is schedule a session with you guys in January, discuss what our optional regulations are, give you a presentation about why we would choose to implement which ones, and leave it to you as to what we'd like to implement as a county. So we will work on getting that on the schedule come January so that we can implement them in June. In addition to that, in looking at our OWTS permit fees, with the number of permits that we're pulling a year, it is everything our environmental health staff can do to keep up to the number of those. So we're in the near future looking at potentially needing someone else to help support that just because of the volumes that we're seeing. And looking at our rates, we have not increased our permit fees since 2013, at least. That's the rates I found in 2013 were exactly what we have today, and we have not changed them. So I have on your desks today a proposition to increase our permit fees marginally to help cover some of that cost, and hopefully to implement a system that will hopefully help reduce the staff time that we're spending to buy us some time before we need to bring another staff member on board to help manage that. Because right now, all of our documents are managed in spreadsheets. Everything's very labor intensive. None of it's public facing. So when someone needs a record drawing, they have to call us and we have to dig through thousands of documents in spreadsheets to pull those documents and get those to inspectors. Ideally, what we would like to do is get that set up on a public facing platform where someone could access that site, pull up their records, and move on from there, which would save us time and make it more accessible for the public. So that is primarily where some of these dollars that we're increasing are going to go to help cover. And then in the future, see where the program goes. Here, kind of to compare what the state's at, so the green bars show a range of different health departments across the state and where they are with their fees currently for these services. The blue line is currently where Elbert County Public Health is at with our fees, and the red line is where we're proposing adjusting them to kind of give you a comparison across what the state rates are. I'll come back to that again at the end for questions and answers if you have questions beyond that. If you guys are okay, I'll move on to the rest and finish up. Vital Records is our next program that I have an update on, so we are right at about the same as we've been the last couple years as far as birth and death certificates that we've issued. It's a program as a service we offer to the community that is not large, but it is very important to those who utilize it. So we've issued 138 birth certificates year to date and 50 death certificates. Revenue ends up being about $4,000 to $5,000 a year from this program, and we are on track to be right about 4. Some of our new education that's happening, this is some of the work that John Michael is working on as far as tobacco education from Douglas County. He is working with a lot of the local schools to help reduce vaping and creating a program that will help educate teachers at the schools to help address this with them, which we're going to use some of our tobacco money to help fund that education program so that the schools aren't incurring that cost, as well as working with programs like Connects for Family as a pilot to help with kiddos that get caught offending so that they don't fall back into the system, where they can use education, peer support, and different methods to help get their community hours served there. And some of the fall outreach events, we did back to school nights at Agate, Elbert, Kiowa, and Elizabeth this year. We're talking about some wellness conversations with the county, and we've been at the county fair, like I said, this year, as well as the 5K fun run in Elizabeth this year, and we will be at the Elbert Christmas Bazaar as well. We continue to work with CSU Extension and the Colorado National Collaborative to help with suicide reduction, and are working really closely with them and some of the local churches on that. And then again, there's some of our community outreach events down there. We wrapped up our year as far as our blood drive totals, right on track with where we've been at all of our quarterly drives. One of the problems we're having with our drive is that our scheduling of it, when people come in and do Power Red donations, so you can come in at one appointment and give 2 units instead of 1, but then you're not eligible to donate at our next drive. So I've been trying to push to get them to give us 1 more time a year so that we can get those people back on track with where their donation schedule would be. However, our numbers are a little bit lower than what they would like to see at our drive total, so please, I encourage anybody who has inclination to come donate, please come donate with us. If we can get those numbers up, we can help get more drives coming out here to us and help people that desperately need it. And thank you to all of those who have donated with us in 2025. We already have our next dates established for 2026, which is going to be January, April, July, and October. Please look for those. It's going to be held in the Ag Building on the fairgrounds. We do encourage people to make an appointment because there's a survey that you have to fill out before donating. You can get that done before you show up, and it helps speed up the time that you're there. But they do take walk-ins as well. And here's just a little bit of information on blood donation. If you know your blood type, that would show you where you fall. If you are O positive, you can give to almost anybody that has positive blood. If you are O negative, you are a universal donor, and they will hound you for your blood because you can give to anybody else. And then these are the recipients that would utilize blood donations in a hospital setting. Some of the ongoing concerns that we've been working on is the biosolid storage site in Matheson. We did have a third party come out and do an inspection at that site. They did not find any code violations, anything they're doing that does not meet current standards. But as a county, we can sit down and discuss if we want to set additional regulations beyond that. So since this fits very well with the OWTS regulations that we're going to be adopting, I will bring that up in our workshop as well in January. We can look at some additional regulations at that point, sit down and have a conversation and see what as a county we would like to proceed going forth. And then just a reminder, I will reach out individually to you guys, make sure Board of Health plans are done, or Board of Health training plans are done. If you need assistance with those, please feel free to reach out to me at any time. And then for the community, again, if you have a public health concern, please feel free to use our Report Our Health Concern link or give us a phone call. And actually, I need to update that number at 31970 if you have any public health concerns, you can, or email me directly at my extension. Questions or concerns from you guys or the public?
Oh, good job. I don't have any questions. Do we have I guess I do have one. Do we have a blood drive coming up now before the end of the year?
No, this was our last one. October's our last one, so the next one's coming up in January.
January.
Yep.
Okay. All right. I don't have any other questions.
On the fee changes.
Commissioner Buck?
Yeah, I have a few questions. And we can talk about the fee changes in a minute. The cost for the software updates that you mentioned,
Yep.
that you were looking to upgrade to, do you
Something
have some
new.
cost projections?
I'm expecting it to be around $10,000, and the increase in the permit fees would increase our revenue by about $8,000 if we base it on what our numbers were in 2024. I don't know for sure. The hard problem is with the staff that we have, I'm expecting we're going to see some increased costs once we actually get someone in to give us an estimate, because we have a lot of data that needs to be migrated. And it would take us a long time if we're doing that ourselves. So I expect there would be an increased cost beyond that. But we're looking at trying to keep that as cost-effective as we can, so we're not spending a lot of money, but I do anticipate it will be about $10,000 for new software and that migration.
Do you feel the increases that you are proposing cover the additional expenses from 2013 to 2025? Do you feel that the expense or the revenue generated will cover the increased expenses for that time period?
Meaning in retrospect?
Well, you proposed some revenue changes.
Yep.
And I'm asking if those revenue changes will cover those costs that have increased, I assume, from 2013 to 2025. That's quite a long time to increase your fee structure. So
Right.
I'm questioning whether you think that's enough, it's adequate, you think it's right on the money. Where do you think that falls?
I think it's right on the money, to be honest. I was going to say, it's hard to say with OWTS because, like you can see in our years looking back, it changes every year. So I think that's something that going forward, every 2 years, we'll need to evaluate and make sure that we're not over-exceeding what we're bringing in addition to making enough money to help support that program. But like I said, a lot of the stuff is dated and needs to be brought up.
And then as far as our fees versus neighboring counties and our neighbors, what are we seeing there?
Yep, and we are on the low side of all of that. So let's,
Yeah, you had a graph, I think.
yep. So we're right on the low side of average as far as our new systems, and we are on the bottom end of everything else as far as, and that's across the state.
So we are on the bottom end of everything else. Why would we not?
Go
be at-
higher.
Well, at the middle range. Is there a reason that we decided, hey, let's go at the bottom end?
We've
You're asking
all,
for a software, you want,
Yep.
you want additional help potentially.
because
but
we
we're at
want
the
to
bottom.
protect the residents as well. I was going to say, we also don't want to.
It's a balancing act.
Correct. And we need to make sure that we're not generating more revenue than what it's costing us to do it. And right now, we're not quite there to step up with needing more staff to run the system, to run the operation, so we can keep it lower.
So the
than we-
design is to be revenue neutral,
Correct,
is how they design it.
correct.
So the only other question I had was, if someone came in to give blood,
Mm-hmm.
and they've already donated through Vitalent,
Yep.
do they need to retake the survey?
So the survey needs to be done on the day of donation. So if you're registered to donate, they will send out that survey to you that morning. You fill it out before you come. Because it goes over questions like, are you experiencing
Current,
any illnesses, or you on any antibiotics for any reason?
Okay, so every
So-
time you donate, you
Yep,
redo
you
the
fill it
survey.
out again.
Okay, thank you.
Yep.
That's all I had.
I don't have any questions. Commissioner Schroeder?
So as far, going back to our special meeting in January, will that have any impact on the proposed fees?
No. So the regulations we are adopting are more going to affect the installers. So it's what we're expecting of our installers.
Okay.
Real quick, one last question.
Mm-hmm.
On that software, is there reoccurring fees, like licensing fees, or is it a one-time cost?
There will be reoccurring fees, but it'll be a one-time cost for the data migration,
Do you have any idea what the reoccurring fees are?
about $4,000 annually. It is what I got from one of the systems. It depends on what platform we pick.
Okay, thank you. Good job.
Thank you.
No, I don't.
And so in regards to that, trying to be revenue neutral on our fees, over the past few years, then at least since you've been in as the director, the fund balance has stayed the same, gone up, reduced?
The fund balance has dropped a little bit, the general fund. And the hard part with public health is that we get very little money from the county, so from our per capita allocation. So that fund balance helps protect us if we see grant changes, which we've seen over the last year. So what can happen is monies that's promised to us from a federal and state level can be taken away. So that cushion gives us staffing. In the event that that happens, then I can continue to keep my staff on board until I get funding sources reestablished.
Understood. And so I think probably this modest increase I'd be okay with. But again, keeping in mind, we want to be revenue neutral on that. And if our fund balance in public health continues to increase, then we need to see what we're doing there, just to keep an eye on it. So, and I know you do. I appreciate that. Appreciate your work.
Thank you, Dallas.
All right, thank you.
Okay, thank you.
Gentlemen, any further discussion on this?
I have no discussion items, but I would like to go ahead and make a motion. Chair, I'd move that we approve Resolution 25 TBD, a resolution amending the on-site wastewater treatment system permitting fees in line with the presentation that we've seen and the attachment to our resolution.
Okay, there is a motion. Is there a second?
Second.
There's a motion and a second. All in favor, sign of aye.
Aye.
Aye. Motion carries. Thank you. And then with that, can I get a motion to close this portion of the Board of Health meeting?
Mr. Chair, I move that we close this Board of Health.
Is there a motion? Is there a second?
Second.
All in favor, sign of aye.
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 Aye. Motion carries. All right, we will now go back into our regularly scheduled board meeting. Do we need a motion to open that, Lance, or can we just resume?
You can just resume. You've already opened the meeting.
Okay, perfect. All right. Next item on the agenda is the consent agenda. Is there a motion to approve the consent agenda as provided?
Yeah, Mr. Chairman, I recommend make a motion that we approve the consent agenda as presented.
Second.
Motion is second. All in favor, sign of aye.
Aye.
Aye. Motion carries. Next item on the agenda is elected officials, department heads, and staff reports. Are there any elected officials here that'd like to give status or report? All right, any department heads would like to give a status or report? You're making it too easy. Any staff reports? Sean, do you have anything, sir?
Actually, I did want to take the time to remind you all that we posted the county surveyor position as well as the land use and water planner position for next year. So if you know anyone who'd be a good fit or might be interested, they can contact the county HR, or even for the land use and water planner, you could contact any of our county commissioners.
All right. Anybody else? Okay, seeing none, then we'll move on to the next item, which is the citizens' public comments. This portion of the agenda is reserved for those who wish to comment on the BCC or to the BCC on items of county interest that are not scheduled for discussion or action. This time will not be used to make political speeches nor personal attacks. Individuals will be limited to one opportunity to speak for a period of up to 5 minutes during this portion of the agenda. Are there any public comments? Morning, sir. Give us your name and address.
Good morning. David Quattrochi, 3855 Mountain View Meadow Circle, Parker 80138. Good morning, Commissioners. This is in regards to the Coyote Ridge final resolution vote scheduled for this afternoon. There's a little bit of confusion. I wasn't sure if public comments were this morning or this afternoon, so that's why I'm here this morning. I'm David Quattrochi. I'm one of the principals of Coyote Ridge. I'm also the author of the letter that was submitted to the commissioners.
Let me interrupt. Give me just a minute. This is on the 1 p.m. agenda. So should he wait till 1 p.m. or can he make his comments now? How do we proceed?
That's really up to the board. The item at 1 o'clock is continued from the 8th. It was not continued for public comment. Public comment had been closed, and we were in the middle of the board decision. So that item is not anticipated to be reopened unless the board reopens it. So you could certainly take comments now, since that item is not scheduled for discussion at 1 o'clock.
Okay.
Or the board could decide to reopen the public testimony, in which case you can do that at 1 o'clock, or you can continue it to a later date. But right now, it's not scheduled for further discussion. It's scheduled for a final board decision.
Okay. I don't have any objection to hearing what you got to say, Commissioner Schroeder.
Yes, I'm going to Oh, I'm sorry.
Okay, go ahead, sir. Sorry for the interruption.
I'd like to, present a couple of comments to give you some more information. If we can't get a reversal on the previous decision, at least a continuance, so we can get more information to the board. The letter that I had outlined the frustration that we've experienced throughout the rezone process. And we've been in that pipeline for almost 2 years. So I'm here respectfully today to try to get the board to reconsider and correct what I consider to be an injustice with the denial. In short, our position is that our application has met every county requirement. We've received approvals from every single agency on the checklist. Last session, we had addressed point by point every objection that the Planning Commission had submitted in their denial recommendation. So I understand the board maybe doesn't rely on, but you look for recommendations or guidance to approve or deny an application from the Planning Commission. To be on the record, the July 1st Planning Commission meeting that we had, we faced a Planning Commission, a couple of members were looking to deny our application based on their personal reasons. And I can give a couple of examples. One example, one Planning Commission member stated that she lives behind a busy street and traffic is getting crazy already, and she's going to deny our development because she's afraid that it might increase the traffic behind her house. I mean, that's a personal agenda item. That isn't being objective. Another member stated that he drives by this intersection regularly, and it's a beautiful piece of property, and he doesn't want to see it marred up with a bunch of homes, a bunch of houses on there. So I understand that they're trying to give guidance to the board, but it should be objective, and we just want a fair shake. I guess the last thing I wanted to tell the board is that the last thing that I want is to have an adversarial type relationship with the county. I've lived in the county for 25 years. I've worked here for 20 years on the fire department. I live here. I'm not going anywhere. I want to have a good rapport with the county. We've been working with Jennifer at the Planning Commission. She's been awesome. Everybody we've worked with has been very accommodating, and we've bent over backwards to meet every requirement and jump through every hoop. It's been a long, drawn-out process, and then at the last minute, we feel like we had the rug pulled out from under us. So I feel like an injustice has been done. I'm hoping it's not too late to correct that. One other thing, we've gotten some feedback that duplexes are not the hot ticket. So we've got currently 32 duplex units in this development. We've reconsidered that. We're going to eliminate all of the duplex units, and instead of 32 duplexes, we're going to replace that with 16 single-family homes on larger lots, 50 to 80-foot lots. We're hoping that this may be more palatable for the board to consider. That's all I've got at this time. Any questions for me?
I don't have any questions,
No
sir.
questions at this time.
Okay. Thanks for your consideration.
Thank you, sir.
Thank you.
All right, any other public comments? Good morning, sir.
Good
Morning, Commissioners. Don Gray, 16,000 Highway 86. I'd just like to ask the county if they have any updates on the litigation that Excel, Public Service Company of Colorado, has brought to the county at this time, as far as dates, updates that we could have at this time. Simple question. Thank you all.
Thank you. And understanding it's in litigation, we really can't comment. Lance, do you have anything you want to contribute to that?
Sorry, I was reading something else. Comment on which litigation issue?
On the Excel Energy?
Yeah, really no update different from on the 8th. The PUC did agree with our position that this should not be expedited, that the county should get a full hearing along with El Paso County. All of that is being currently scheduled and planned.
So we don't have any firm dates yet as to,
Not to my knowledge. We do have outside counsel that's trying to schedule, and we've passed on dates that we think will work. To my knowledge, they have not landed on the final dates yet.
okay, sir.
Excuse me, I'd like to clarify the question. The question was for the county litigation that Excel has brought towards the county, not at the PUC level, but at the county level. Just a date is all we're looking for.
Thank you, sir.
Yeah, I think that's about the Rule 106 procedure in the district court. That has been put on hold pending the PUC action. Much of what would have happened in the district court is now being taken over by jurisdiction of the PUC. We have not abandoned our arguments in the district court, but it's all on hold until the PUC is resolved.
All right, thank you. Any other public comments? All right, we'll close the public comment section. Next item on the agenda is the discussion items. First item is consideration of cost sharing of $5,000 with the town of Simla for the purpose of funding with local matching funds, a water quality engineer study with a grant from the Colorado Department of Local Affairs. And I'll just mention here that this is in the town of Simla. If you live there, you turn your water on to take a shower, that's what you're using. That's what you're getting. So we realize that this is a town of Simla's issue, but it's also a county, these people are county residents. So with that being said, go ahead, sir.
Yes, my name is Mike McEwen. I'm the Public Works Director in Simla. We have a long history of bad water, poor water quality. 2018, we contracted with an engineering firm. They gave us a list of everything we needed to do to fix the water. That project was completed in 2022, and obviously it did not take care of the issue. We have hired a new engineering firm, and what we're proposing is having them do a preliminary study to tell us what we need to do. We know that we have 14,000 feet of cast iron pipe that was installed in 1914, and we use sodium hydrochloride to disinfect for bacteria, and that reacts with the iron. We also have high iron content in the aquifer that we use. The preliminary report is $20,000. DOLA has committed $10,000. The town could commit $5,000. So we're just asking for the county to commit to $5,000 to get that study done. And then we will come back when we have the study to see what options we have for further funding from the county and hopefully escalate it to federal funding. And that sample you have, this I took yesterday from a resident that complained. So it's a little bit better than what you have. When we get those complaints, we flush a hydrant upstream and downstream to try to clear the water out. And this is what came from that meter. So it's even a little bit worse than what you have there. So right now we're just asking for a $5,000 commitment to get the preliminary study completed.
Okay. Commissioners, you got any comments or questions? Commissioner Buck?
It seems there's additional issues besides just water quality. In our workshop that we did, there's a water pressure issue as well, based on the quality of some of those pipes being restricted and being sized down from all the contamination that's built up over the years?
Yes.
Those are old pipes, 1914.
Yes,
That's pretty old.
yes.
So you have multiple issues, it sounds like.
Yeah, at the water towers, there's 7 or 8 houses that are close to it that have 22 to 25 pounds per square inch. CDPHE recommends 35 PSI. At 20 PSI, we have to issue a boil alert. So those 7 or 8 houses are very close to the town having to issue a boil report. And also there's the fire flow with reduced flow and reduced pressure. Those houses, if there's a fire, it would be difficult for the fire department to battle those fires.
So it becomes a safety issue?
Yes, it's a public health issue, a safety issue, and just a water quality issue. So we have 3 issues.
So one of the things I mentioned in our workshop was the economy of Simla. I think it makes it more difficult to sell a home. I think it makes it more difficult to attract businesses or attract new residences. I think it's a deserved project, for lack of another word, but I think it should be a priority for the county. You guys are tax-paying citizens out there of the county, and if you have money in the bank, if you have any unassigned reserves, I think that's what that money should go for. That's what it's for.
Yes.
If we have anything, I would be in favor of trying to help you guys out.
We appreciate it.
So when this first started, we had a lot of discussions about it, and we're in contact not only with DOLA, but with Congresswoman Bobert's office, seeing what we can do on a federal level to assist the town as well. So we've got to get, people can't even take showers with this kind of stuff. So, I mean, I don't think anybody in this room would take a shower with that, would you? And so we understand that there are options, and there are options of water filtration systems, and they're supposed to last for 10 years, and some of them not lasting a year. The filters are being ruined with all this sediment and stuff that's in there. So not only that, the cost that they have for buying bottled water, so forth, that there's just a lot of little moving parts in this, but it's definitely a health safety issue. And I got to tell you, I'm a cancer survivor from kidney cancer, and I wouldn't drink that. Some say, well, once it settles, I don't care, it's contaminated. So,
Yes.
but anyway, Commissioner Schroeder?
Yeah, so I appreciate you coming in today.
Thank you
And
for
I meant
having
to mention the other day, I appreciated your shirt yesterday, or whenever we met, and I appreciate your shirt today.
Yes,
So
thank you.
I appreciate that very much. I agree, that the appearance of this water is not good for the town. But just to be clear, so we're not putting out maybe skewed information, CDPHE is still claiming that this water is safe. That's correct?
Yes, CDPHE, we test the drinking water for E. coli, TTHM, HAA5s, volatile organic things. We recently tested for PFAS. They do not test for iron in the water. So CDPHE does say the water is safe to drink, but not many people want to drink it.
Understood. I just don't want to set off a panic that we've got some type of a contaminant that could cause illness there, and maybe over time this could, but it obviously needs to be addressed. And I'm fine with giving support and encouragement and having us support you in any way we can, but I think it does need to be a town lead item. I'm okay with kicking in here to find out exactly what needs to be done, but I would say that the county needs to be in a support role and not the lead role in this, since it is a separate entity. But I have no problem kicking in here and getting this study done so we know exactly what needs to be done to correct the problem.
Yes.
All right. Is there any public comments? Okay, thank you, sir.
Thank you.
All right. I get a motion to move this item, number 1, from discussion items to an action item.
Yeah, Mr. Chairman, I make a motion to move discussion item H1 to action item I3.
There's a motion. Is there a second?
Second.
All in favor, sign of aye.
Aye.
Aye, motion carries. All right, next item is action items, and that is consideration of amended resolution 25-02A, organizational meeting 2025, appointments and reappointments. All right. Any comments on that? Okay. Give me just a second to get caught up here, just a minute. Commissioner Buck, you have any comments on this?
No, sir, not at this time.
Commissioner Schroeder?
As I understand it, this is just a housekeeping item to catch up for the appointments that have been made since the original appointment resolution was, organizational resolution was passed at the beginning of the year. So this is mainly a housekeeping issue.
Right. All right, is there a motion?
Mr. Chair, I'll move we approve resolution TBD, a resolution amending resolution 25-02A, organizational meeting 2025, appointments and reappointments.
All right, is there a second?
Second.
There's a motion and a second. All in favor, sign of aye.
Aye.
Motion carries. Next item is consideration of resolution certifying cost of prosecuting crimes alleged to have been committed by persons in the custody of the CODOC. Any comments with that, Commissioner Schroeder?
Again, this is a housekeeping resolution that we do annually that certifies the costs of prosecuting crimes that occur within prisons, within the county, within the district, the judicial district, and it's just a housekeeping item that we need to certify that will allow us to get reimbursement from the state.
All right, Commissioner Buck?
No questions or comments.
All right, is there a motion to approve?
Yes, Mr. Chair, I'll make a motion to approve the resolution certifying costs of prosecuting crimes alleged to have been committed by persons in the custody of the CODOC.
Second.
All right, all in favor, sign of aye.
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 All right, motion carries. All right, next item, item number 3, which is just recently moved from discussion, and that is contribution of $5,000 to the town of Semla for the purpose of funding for an engineer study. Is there any further discussion on that? Commissioner Buck?
No further discussion.
Commissioner Schroeder?
No.
All right, is there a motion?
Mr. Chair, I'll move that we approve $5,000 for cost sharing with the town of Simla for the purpose of funding with local matching funds a water quality engineering study with a grant from the Colorado Department of Local Affairs.
Okay, there's a motion. Is there a second?
Second.
All in favor, sign of aye.
Aye.
Motion carries. All right. Next item on the agenda is executive session.
As I've said before, this item is a placeholder in case something should come up that needs to be addressed in an executive session. I'm not aware of any such item for today.
Commissioner Schroeder, do you have any reason for executive session today, sir?
No.
Commissioner Buck?
No, sir.
All right, we'll move on to the next item. Next item is board planning. Gentlemen, I ask if you have any agenda items for the next meeting. Hearing none, workshop study sessions. Pending hearings. Okay. Next item is the land use at 1 o'clock, so we will recess this meeting until 1 p.m.